Thanks for joining us today for a very important workshop. It's called Healthy Aging, Know Your Options. My name is Andy Williams, and I'm the Executive Director of Community in Crisis, a small grassroots organization based in Burnsville, New Jersey, that is working hard to prevent substance use disorder by raising prevention education about the danger of substances and also helping people in recovery achieve a healthy and wholesome life. Today's workshop is called Healthy Aging, Know Your Options. I'm going to share my screen with you so that I can talk you through some slides before you join our panel of experts who will talk you through some alternative approaches to pain management. So, as I said, I work for Community in Crisis, and our mission is to lead and unite communities to reduce the incidence and consequences of the misuse of substances. And we do that through education, prevention, and holistic support, whilst trying to reduce stigma associated with substance use disorder. So as I said, our workshop today is called Healthy Aging and Know Your Options. So where are we at the moment? It's the #1 public health crisis back in 2019 and remains so today, even during the pandemic of the coronavirus, which has really distracted us from so many other things going on around our lives. But today I'm here to refocus you on things that are really important to keep you safe and healthy. In 2017, an average of 130 people died a day from an opioid overdose. So it's still pretty shocking figures going on, and it's increasing at the moment during the pandemic. There were over 70,000 drug overdose deaths in the US in 2017. And last year, almost 4 million prescriptions were written. Over 15,000 Narcan deployments were made. Narcan is the life-saving antidote when there is an overdose, and more than 3,000 suspected overdose deaths last year. So the numbers are shocking. I just want to read some startling facts out to you as it may pertain to you or the people that you care for. About 1/3 of Medicare patients, which is nearly 12 million people, were prescribed opioids or painkillers by their doctors. In 2015, it was shown that 2.7 million Americans over the age of 50 abused prescription painkillers. And by abused, I mean that they took painkillers that were not prescribed to them, or they took more than their doctor had recommended. And the hospitalization rate due to opioid use has, for those over 65 and over, has grown 5 times in the past 2 decades. 2/3 of teens report that they got them from their friends or family. So that could be us if we're keeping them very available in our homes. And just know this fact: 3 out of 4 heroin users began with prescription pills. So the objectives today of this workshop is to try and help you prevent dependency and leading to addiction, to try and help you reduce the supply of opioids in your own home and in the community at large, understand the risks associated with opioids and the signs and symptoms, etc. And also to, more than anything, increase your understanding of what your alternatives are. That's really important, and we'll be getting to that shortly. So let's just talk a little bit about what you can do about all of this. So store your medicines in a safe place. I mean, we have to have them sometimes, and they're prescribed to us, and that's perfectly fine and perfectly necessary. But try and store them somewhere safely and know how many you've got. If you don't need them anymore, if your prescription, you're not feeling the pain anymore, or they're expired, get rid of them, because they can still be diverted by somebody visiting your home, like a cleaner or a painter who's in to paint your house at that time. So get rid of them if you don't need them, and which will really help the people that come into your house who might be looking out for them and prone to abusing them. And spread the word. Talk to your children, grandchildren, friends, family, neighbors about what you've learned today, so that we can help more people than just those listening in today. And just regardless of the reasons for needing to go and see a doctor, here are some tips. Bring a list of your medications with you, so because he or she's bound to ask you what you're taking at the moment, and write down any questions you have for your doctor, because often we forget when we walk in that doctor's office. Some ways around that is to bring a friend, trusted friend or family member with you who can help you remember and ask the right questions, and also remember what the doctor's told you. And if you are prescribed opioids, ask her or him what your options are, what alternative approaches are there to managing your pain. Here's some facts on opioids. Opioids, we don't all know what they are. They're commonly known as Percocet, Vicodin, hydrocodone, names like that. So check the label. Opioids can be used to treat moderate or severe pain, and they're often prescribed, as we saw in those stats. And they are an important part of treatment, but they do come with some serious risks, which you need to know about. The use of opioids can have a number of side effects, such as tolerance, dependency, constipation, increased sensitivity to pain, not decreased, depression, and so on. And if you have a history in your family of substance use disorder, a history of drug use or misuse, depression, anxiety, make sure the doctor knows that, because that's something very important for her or him to know when prescribing you your medications. So lastly, talk to your doctor about ways that you can manage your pain that don't involve opioids. Some of these options may actually work better than others. And some patients in studies have shown that their satisfaction in pain management is just as effective, if not more so, than if they were to use opioids. And if your doctor does feel that opioids are necessary, ask her or him to provide the lowest dose possible for only 3 to 5 days. Hopefully you don't need more than that. And 5 days has been shown to be a critical turning point in some people's dependency and potential addiction. And many over-the-counter medications have strong agents in them, which can work just as well as a prescription. And these are things like ibuprofen and naproxen and so on.
Thanks so much for joining us today. For more information, please email us at cicseniореducation@gmail.com. We'd be happy to answer any questions you may have and provide additional resources. Be well and stay safe.